Hello, everyone. My name is Dr. Jennifer Lee, and I'm a community engagement consultant with NASDAD focusing on women of color. If you are watching this video, that means you either work at a local, state, or tribal health department or at a community-based organization. I want to thank you for utilizing this resource to prioritize community engagement in your ending the HIV epidemic efforts. Social determinants of health are conditions and the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. And as we all know, women of color are an important community that must be meaningfully engaged and involved to ensure the success of ending the HIV epidemic. I am honored and privileged to be joined by Dr. Charlene Sinclair. She is a grassroots organizer steeped in advancing the intersection of race, gender, and economic justice, a highly sought after human-centered strategist, design thinker, and facilitator who serves as a consultant, trainer, and advisor for leading social change organizations and leaders. Charlene has worked to mobilize new funding and provide capacity building resources to grassroots electoral organizing and policy change efforts led by low-income women, women of color, and transgender people. Hello, Dr. Charlene Sinclair.
Hello, Dr. Jennifer Lee.
So first, I want to start with, just tell us a little bit about yourself and your lived experiences, your expertise, what you bring to the table.
I always begin by telling people that I've been a community organizer for the last 30 years. And I say that not only because it is a profession, but I have seen the process of community organizing as a process of learning who I am and of helping me be able to claim public space. So many years ago, I grew up in Newark, New Jersey. So I grew up in a rather economically challenged communities and but with a sense of a broader community ethos in it. And when I was 16, I became pregnant, and which made me outside of the community process. And I ended up going to college in another state with my child and my child's father, and in that process dipped even further down economically. And we were living in a community that where many people were like us, were being very challenged economically, lots of um, drugs, but even beyond that, lots of you know buildings that were owned by slum landlords and rodents and all kinds of things there. And it was through community organizing, when organizers knocked on my door to organize folks against this landlord, that I began to recognize that the environment that I was in was not one that I was destined to be in, but that it was one that was actually created by human hands and then needed to be undone. So when I tell people about who I am, I have to talk about that piece of myself as a very important part of my both my personal development and my political development.
Thank you, Charlene. And so what are your initial thoughts or feelings when we mention social determinants of health as it relates to women of color? And in your work, which of these social determinants have created the most barriers or challenges for women of color to access HIV prevention services?
Yeah, it wasn't until I'd say maybe 15 years ago that I actually began to hear about the impact of our environment on our entire life. Right. As I mentioned before, coming out of, low wealth communities and coming out of communities that had a lot of challenges, the broader social environment was one that looked at human pathology. It was something that you did wrong, something your parents did wrong. If we can only get you right, then things would be okay. And then as I began to learn more about the structures of society, I began to actually engage with folks that were coming out of public health and that were beginning to talk to me about how the environments that we were in actually had direct psychological, emotional, as well as physical impact on our bodies, our mental capacity to just push through. A dear friend of mine now calls it not post traumatic stress syndrome, but persistent trauma systems environments, post traumatic stress systematic environments. And so that's what social determinants of health are to me. It's the recognition that the very fabric of society, the way it is structured, can actually lead to either good health outcomes or very detrimental health outcomes, to the point where it could even lead to your death. Knowing that the structures of society can actually create environmental processes that are not conducive to us living, much less living healthy and whole lives. And so I think it's important that more people begin to start moving towards this understanding for us to be able to craft better societies for human thriving.
I want to ask you about how can, health departments better center the embodied knowledge and experiences and expertise of women of color in ending the HIV epidemic?
First of all, I think that we are in an incredible moment right now where there is a better understanding of the idea of public health. Many people would think that health and health department somehow has to do with your trip to the doctor, but and not about the fact that this whole structure of public health is so essential for how society moves, not just for the individual. And I think that now we have this opportunity for public health and health departments to actually be in deep relationship with community. Now that people have an opening around their understanding of it, how can we be co-partners in actually dealing with some of the deep ways in which our health in communities have been obstructed? And so that means that departments of health have got to take this moment to open up the conversation and to begin talking more robustly about social determinants of health. And that means that health departments have to engage more robustly in broader community enterprises and broader community challenges and issues. Because unless we can, for example, create an environment where people can begin to speak to who they are and speak to their challenges, then we can't actually do anything about any epidemic or pandemic. Because what that means is that we create environments where people are not even being full about what is happening to them within their own communities. And so I think that part of it is to see themselves not as some outside agency, but as co-partners with community, to be able to actually have people from community that can be trusted messengers, to be engaged with them in conversation with community, to be able to actually bring people from community into the whole process of the ecosystem, to craft systems and structures that are not just done because they read it in a textbook somewhere, but because it understands the culture and the ethos, the movement and the rhythms of those communities themselves. So I think that that is the way in which health departments can effectively, particularly in this moment where I feel as though the opening is so present, to move forward.
Thank you for that. Um, and a kind of a related question to that then is, how do health departments disrupt the current status quo that's been operating and is inefficient to meet the needs of women of color? And, I think you spoke about several things previously that you can really probably amplify through this question too.
The way in which our culture it continues to evolve, it is, even though we have communities that are fighting for something different, they are codifying mechanisms of shame. They are like codifying and making it so hard for people to have access to, full care, to have public access to their own reproductive possibilities, right? And so that was then. And now I think, fast forward now, and again, that still exists. I have one of my like deepest, friend, a brother to me, who is a transgendered man. And he totally cut out of any conversation around reproductive justice. And cut out of really talking about the challenge of going to get basic health care, right? Just cut out of, and in fear around what he is going to encounter when attempting to go and access care, right? And so we still have a variety of ways in which we determine who gets care, how are they treated when they get care, what issues are salient versus what are we going to actually create shadows and shame around. And so there's so much that we need to do to actually begin to not only fight for programs, but we also have to fight for cultural shifts. We have to, through our programs, shift culture. So if our programs don't do that, then they're part of the problem, even if they might be providing some level of good, right? And so I do think that it is important that we begin to understand that the way in which we form and deliver our actual programs will either help to shift how people think of the people accessing it, or it will continue to reinforce this old idea of a pathological, shameful individual. And so I think it's really important for us to recognize that program development is not just about accessing medicine. It is about how are you also changing the culture of society around health. And so that is thinking more along those lines would be, I think, really important.
Thank you. Um, and so, what other recommendations would you have for health departments on how to better engage women of color to end the epidemic?
I think the one is, if I could, go further with this piece around changing culture, one of the things that I would do would be to tell health departments that the people that have knowledge are the people that have the experience of whatever it is that we are trying to deal with. And so, excuse me, how do we affirm that knowledge that people have, and have that knowledge be a part of our research, our experimentation, our program development, our program delivery. Like, how is that knowledge actually accessed all along the way? And that knowledge is often actually more salient. It's like more relevant than much of the other research, because we could, there was I remember, like, back, was that okay, now my age is showing. I think it was in the 80s or something like that. We There's this old movie, Claudine, and it talks about, this single woman raising her kids. And there was a time in which welfare offices, you couldn't have men around, right? Because they figured if you had a man, he should be taking care of you and your kids, and didn't matter if he was the father or not. It didn't matter if there was jobs for him to have or not, or, all of that, right? So the programs were developed to actually help women become more pure, as opposed to how do you develop the program to support this family. But if they had had a conversation with women and the men in community and understood the flow of community, what they would understand was the jobs weren't there, and that if that women actually engaged in sort of marital relationships, they lost everything. And so there were rational decisions being made, not moral decisions being made around how they lived their lives. And so if departments actually engaged in those questions with the people themselves, then they wouldn't create programs that made people have to actually hide deep loving relationships under the carpet. And I see that even if we're talking about the HIV AIDS and the epidemic, it's like we create programs that actually facilitate hiding and facilitate the ways in which people don't access because they don't want to publicly access, right? So I think that if we have the people that are directly impacted working every single step of the way to bring in the knowledge of the community, what works and what doesn't work, what can people hear when they hear that word, or what do they hear when they see this kind of framework? What is real as opposed to what is theoretical, right? If we did that across each step of the way, I think it would have a huge impact on access.
Thank you so much. Your wisdom is just always so amazing, and we are grateful that you were part of our conversation for this toolkit. Thank
Th-
you.
Thank you, Dr. Jennifer Lee. I appreciate you.